Hey, this is Mason Haley with Wahpeton Family Dentistry. Our goal is to take the fear out of dentistry and help patients make informed decisions about their oral health. Why do I have bad breath? Today we're talking about a question that a lot of people wonder about, but not everyone wants to ask out loud. Why do I have bad breath? First, let me say this clearly. Bad breath does not mean you're a bad person. It does not mean you're gross. It means something is causing an odor. It's our job to help figure out what that something is. Everyone has had bad breath at some point. If you say you've never had bad breath, your pillow might disagree. Bad breath is also called halitosis. This is a fancy dental word. It sounds like a dinosaur, but it is really just the name for breath that smells unpleasant. The good news is that bad breath usually has a cause. And when we find the cause, we can usually make a plan to improve it. Let's start with the most common reason, bacteria. Your mouth has bacteria in it all the time. That is normal. Some bacteria can be helpful. Some can be troublemakers. When food, plaque, and bacteria sit on your teeth, gums, or tongue, they can make smelly gases. Think of bacteria like tiny roommates. If they clean up after themselves, fine. If they leave dirty dishes everywhere, the place starts to smell. One of the biggest hiding spots is the tongue. The top of the tongue has little bumps and grooves. Food particles and bacteria can get trapped there, especially toward the back of the tongue. This is why someone can brush their teeth and still have bad breath if the tongue isn't cleaned. Your tongue is basically like a carpet for your mouth. And like carpet, it can hold on to smells. That does not mean that you need to scrub your tongue like you're sanding a deck. Be gentle. You can use your toothbrush or tongue scraper. The goal is to clean the surface without hurting it. Another common cause is gum inflammation or gum disease. If plaque sits along the gum line, the gums can be irritated. They can bleed when you floss or brush. They may look puffy or tender. Bad breath that does not go away can sometimes be a sign of gum disease. Gum disease can create deeper pockets around the teeth where bacteria can hide. Those areas are hard to clean at home. The bacteria can produce a very noticeable odor. This is one reason a dental cleaning can help so much. It can trap food and bacteria. Sometimes old fillings or crowns can have edges that can catch food. Sometimes food can get stuck between teeth of a space like a cavity or a broken filling or gum changes. If food is trapped and bacteria are feeding on it, the smell can get worse. Your mouth is not supposed to be a storage unit for yesterday's lunch. Dry mouth is another big one. Saliva is one of your most important helpers in the mouth. It washes away food particles and helps control bacteria and keeps your mouth moist. When your mouth is dry, bacteria and food debris can build up easily. That can lead to bad breath. Dry mouth can happen for many reasons. Some medications can cause it. Mouth breathing can cause it. Snoring can cause it. Not drinking enough water can also make it worse. Tobacco, alcohol, and some medications can also contribute. If you wake up with a mouth that feels like the Sahara Desert, dry mouth may be part of the problem. Morning breath is often related to this. When you sleep, your saliva slows down. Your mouth gets drier. Bacteria have more time to hang out and produce odor. That is why even the nicest person you know can wake up with breath that could peel paint. It is normal to have some morning breath, but if it is strong all day or does not improve with good home care, it's worth checking into. Food and drinks matter too. Garlic, onions, coffee, and other strong spices can affect the breath. Sometimes the odor comes from the mouth, sometimes after digestion. Odors can come out through the lungs as you breathe. That is why a mint may cover the smell for a little while, but it's not going to fix it. A mint is like spraying air freshener in a gym bag. It may help for a minute, but the real issue is still there. Tobacco is another major cause. Smoking and chewing tobacco can leave odors, dry mouth, stained teeth, and increase the risk of gum disease. If someone uses tobacco and has bad breath, Quitting or cutting back can be a big step for the oral health and the overall health. Dental appliances can also collect odor. If they are not cleaned well, dentures, partials, retainers, night guards, clear liners, and athletic mouth guards can all trap bacteria. If your retainer smells like it's been living in a swamp, it needs a cleaning plan. Rinse it, brush it as recommended, store it properly, and follow the instructions your dental team gives you. Please do not boil your retainer unless you want modern art instead of a retainer. Also, if you're a patient at our practice, you can bring your retainer in and we'll clean it at any routine checkup or cleaning appointment at no charge. Now, bad breath is usually from the mouth, but not always. Sometimes sinus drainage, tonsil stones, reflux, or certain medical issues can play a role. Tonsil stones are little trapped bites that can form in your tonsils and smell pretty rough. Sinus drainage can coat the back of the throat. Reflux can bring stomach acid or odors upward. Diabetes and some other health conditions also affect the breath in certain situations. This is why we do not want to guess forever. If we check your teeth, gums, tongue, and dental work and everything looks healthy, we may recommend you talk to your physician or an ENT to find the cause of the problem. Dentistry and medicine are on the same team. Your mouth is connected to the rest of the body, even though it sometimes acts like its own personality. So what can you do at home? Start with the basics. Brush twice a day for 2 minutes with fluoride toothpaste. Aim the bristles toward the gum line and be gentle. Clean between your teeth twice a day with floss picks, or a water pick. The spaces between your teeth are where food and plaque loves to hide. Clean your tongue daily. Again, gentle is the key. You can brush it or use a tongue scraper. Start further back only as far as you can comfortably handle. Nobody gets a trophy for gagging in the bathroom mirror. Drink water throughout the day. Water helps rinse the mouth. If you have dry mouth, ask your dental team about saliva substitutes. Dry mouth rinses, sugar-free gums, or other options that help fit your situation. Sugar-free gum can help stimulate the saliva for many people, but it should not replace brushing, flossing, or professional care. Be careful with mints and gums that contain sugar. They may make your breath smell better for a few minutes, but sugar can feed bacteria and raise the cavity risk. That is like hiring the burglars to guard the house. Clean any dental appliances every day. Do not sleep in appliances unless you're told to. Do not store them in a dirty case. The case needs cleaning too. If you have a night guard, retainer, partial, or denture that smells bad even after cleaning, bring it in to us to take a look. Mouthwash can help, but it depends on the cause. Some mouth rinses freshen breath temporarily. Some have ingredients that help reduce bacteria, but mouthwash should not be used to hide the problem that needs treatment. If your gums are bleeding, a mincy rinse is not a full plan. It's like putting cologne on a skunk. The skunk smell will still be there. When should you see your dentist for bad breath? If bad breath does not improve after brushing, flossing, tongue cleaning, and hydration, schedule an exam. You should be coming in a minimum twice a year for an exam anyways. Also, come in if you have bleeding gums, swollen gums, loose tooth, tooth pain, food trapping, or bad breath that will not go away. Dry mouth, or a dental appliance that smells bad. These are clues that we can use. At that visit, we may look for plaque and tartar, check your gums, look for cavities, check old fillings or crowns, evaluate dry mouth, review home care, and talk about your medical history and medications. We may take x-rays if needed, and the goal is not to embarrass you. The goal is to find the cause. I know that bad breath can feel awkward to talk about, but dental teams talk about this all the time. It's not weird to us. To us, it's just a clue. Just like a mechanic listens to a car noise, we look for reasoning that something is happening to the mouth. And here is something important. Do not assume you can smell your own breath accurately. Sometimes people worry they have bad breath when others do not notice it. Other times, people do have bad breath but have gotten used to the smell. If you're concerned, it's okay to check and ask with your dental team. We'll be honest and kind. Let's do a quick myth check. Myth number 1, bad breath always means I need stronger mouth rinse. Not true. Mouth rinse may help, but if the cause is tartar, gum disease, cavities, dry mouth, or food trapping, you need to treat the cause. Myth number 2, if I brush harder, my breath will get better. Not necessarily. Brushing harder can hurt your gums and wear down your teeth. Better technique beats more force. Your teeth are not dirty pans. You do not need steel wool energy. Myth number 3, bad breath is always from the stomach. Most chronic bad breath starts in the mouth. The stomach can be involved sometimes, especially with reflux, but the mouth is usually the first place to check. Myth number 4, if my breath smells bad, everyone is judging me. Most people are worried about their own stuff, and your dental team is there to help, not judge. We've seen everything, truly. Teeth, gums, tongues, retainers, mysterious popcorn kernels from 5 years ago. Nothing surprises us. Here's the biggest takeaway. Bad breath is not something you just need to live with. It is also not something to cover up forever with mints. Bad breath is a sign that something may need attention. It might be simple, like tongue cleaning or dry mouth. It might be gum inflammation. It might be a cavity or food trap. It might be an appliance that needs cleaning. Or it might be something outside the mouth that needs a medical opinion. The best plan is to find the source. So, if you're worried about bad breath, start with the basics. Brush, clean between the teeth, clean your tongue, drink water, and clean your appliances. If it keeps happening, come see us. We can help you sort it out step by step. This is Dr. Mason Haley with Wahpeton Family Dentistry. Our goal is to take the fear out of dentistry and answer questions people are afraid to ask and help you feel confident about your oral health. And remember, bad breath is common, it's treatable, and your dental team is a safe place to talk about it.